This presentation will discuss the psychological factors in older patients at risk of falling. This will include some information on the local area where the student paramedic is based, as well as the prevalence of this issue. A scenario from practice will also be discussed. In continuation, there will be a section focusing on the care pathways available to these patients. This presentation will also cover what policies or guidelines protect these patients. According to the World Health Organization, around 28 to 35% of people around the world, around the age of 60, will experience a fall each year. Furthermore, it's an underlying cause of 10 to 15% of all emergency department visits. As you can see, the graph is showing the population in Thanet and Margate, which is the local area I'll be covering. This graph shows a high percentage of people that are aged 65 and over in that area. The next graph is illustrating the number of falls that occur in the 60s and over category. This confirms the previous fact by the World Health Organization, as it shows that around 25 to 40% of this population are experiencing falls. In an interview with some of the local paramedics, I asked how prevalent this issue is. Their response was that it was a very important issue that needs to be looked at, as they're going to at least 2 falls per shift. This next section will involve a scenario witnessed by a student paramedic. The crew were called to a home in the local area where a 65-year-old female had fallen over. She had been laying on the ground for around 45 minutes before the crew arrived and assisted her in getting her up and onto a chair. Upon questioning her, she revealed that she had been falling a lot more recently. However, all of her observations were normal, suggesting that age could have been a factor. She also looked quite anxious. Additionally, she said that she mainly relies on her family or a nurse when she falls, as she has a pendant around her neck that she can trigger when she falls to call for help. After reviewing all of her observations, there was not much the paramedics could do. However, the paramedic did refer this patient to the Falls Prevention Service in Kent. This service monitors the patient's strength and balance as well as their fear of falling, therefore not only looking at the physical needs but also the psychological needs. This section will be focusing on why elderly people fall over, and there are many reasons for this, such as environmental problems like obstacles, slippery surfaces, uneven ground for example, or even other things such as inadequate footwear. There are other medical reasons such as sight and hearing degeneration related to age, which could cause someone to fall over. Other things such as arthritis, osteoporosis, and hip replacements, for example, could also lead to an elderly person to fall. Falls can have lasting effects on an elderly person such as pain, bruising, superficial wounds, hematomas, lacerations, fractures, and even intracranial bleeding, according to the Western Australian Department of Health. However, these are just the physical effects that falling can have. There are many psychological effects that falling has on an elderly person which can severely affect their life. A study carried out by the Welsh Royal Volunteering Service found that around 225,000 people would isolate themselves at home due to the fear of falling again. This fear can leave people feeling hopeless, angry and frustrated as they feel as they're losing their autonomy. Isolation can lead to other conditions such as anxiety and depression, and you begin to lose contact with the outside world. According to Age UK, some elderly people feel as they're not at risk and that falling is just part of aging and therefore may fail to report a fall to a GP or another healthcare professional, leaving them at risk to another fall as no preventive measures are being put in place. According to the WRVS, the Department of Health England introduced a policy in 2001 which aimed at preventing falls in older people. It aimed to give people at risk person-centered care to promote older person's health and independence. This meant that multidisciplinary teams would work with the patient to reduce the risk of falling. They achieved this by training their strength and balance, provided exercise in extended care settings, and patients returning from hospital would also have a home hazard and safety intervention, as well as review of psychotropic drug medications and cardiac pacing. These things form part of the NICE guidelines published in 2013. Unfortunately, due to the psychological issues that arise from falls, such as depression and fear of falling, can lead to the situation becoming worse, and the person can create a loop where they fear falling, therefore isolate themselves indoors. Then, due to the lack of exercise, they become frail and more prone to falling. Fortunately, there are lots of services which help elderly people maintain in contact with others to avoid loneliness and depression. For example, Age UK has an active buddy group which helps older people become more physically active, as well as a befriending service where someone visits an older person who lives alone. There are also other groups such as Community Network, Independent Age, the Silver Line, and even the Casserole Club who aim to provide the elderly with a hot-cooked meal. Specifically in the Thanet area, there are over 20 services which aim to help elderly people overcome loneliness and depression. such as Sunday afternoon outings, home share, call in time, and home help companions.